Hello, my name is Dr. Robert White. I'm a chiropractor with a specialty in nutrition and functional medicine. We're located here in northern New Jersey, specifically Springfield, New Jersey. First, what I'd like to say is I'm grateful. I've been in private practice for over 8 years, and I've helped hundreds and hundreds of people get rid of problems such as neck pain and low back pain and headaches and sciatica and other musculoskeletal problems. In our office, we use what's called a multidisciplinary approach. What we do is we combine chiropractic with massage and physiotherapy and nutrition based on diagnostic testing. We also use one of the most advanced techniques in chiropractic called Pedibond. What Pedibond does is allows us to make structural changes or changes in the shape of your spine much more quickly than if we didn't use it. It's sort of like putting braces on your teeth. Put braces on your teeth because your teeth are crooked, and over time it straightens them out. Well, Pedibond is sort of like braces on your spine. Your spine's supposed to have curves, especially a curve in your neck. And if you don't have those curves, what it can do is actually put pressure on the spine and the nerves that actually come out of the spine. That can lead to symptoms such as aches and pains and headaches and other types of problems, along with other body systems not working like they should. The cool thing about Pedibond is what used to take me a year, say, to make a change in a person, now we can do in just a couple months. Basically, combining all those different types of things I just mentioned, it provides for a much more comprehensive, holistic approach, and it leads to a much longer lasting corrective procedure. Now, people ask me, what exactly is chiropractic? Well, let me explain to you a little bit of the way your body works. Your brain and spine control your entire body. And how the brain and spine control your entire body is through the nerve system. The spine and the nerves that come off it. Those nerves that go to every single part of your body, to your heart, to your lungs, to your liver, to your stomach. All the different organs, all the different systems are in control of the brain via the spine. Now, the bone around the brain is called your skull, and the bone around your spine is called, bones around your spine, are called vertebrae. Their job is to surround and protect your spinal cord. That spinal cord, again, is part of the communication circuit between the brain and the body. Well, if those bones move out of place and actually put pressure on the spine, we call that a subluxation, as you can see here in the picture on the right. Now, on the left is a picture of a normal spine. You'll see the bones of the spine. Those are the white pictures, and the blue things in the middle there are discs, and the yellow nerves that are coming out are the nerves that are coming from the spinal cord that go to all parts of the body. And you'll see in the picture on the right, there's no pressure on those nerves. Everything, the bones of the spine are where they need to be, and there's no pressure on the nerve system, so everything's functioning the way it's supposed to. In the picture on the right, you'll see it's called a subluxation. Subluxation is a physical misalignment of the spine, putting pressure on the nerves of the spinal cord. And on the picture on the right, you can see that bone is actually moved out of place and it's putting pressure on that nerve. Now, a lot of people associate subluxations with aches and pains. Pinched nerve in your neck maybe leads to arm pain or a headache, or pinched nerve in your back maybe leads to low back pain. What people don't realize is that subluxations affect other systems as well. Like there's nerves that go to your heart or your lungs or your liver, and if there's pressure on those nerves that is actually controlling an organ system, those organ systems aren't going to work as well as they could. Here's a fact. 18% of all the nerve fibers are for pain. Meaning, if you have a subluxation, pressure on the nerve system that's that's hitting one of those pain nerves, you're going to know it. Hey, I got some aches in my shoulders, and my low back hurts, or maybe my mid back. And usually most people go do something about it. But with the 82% of the nerves, those nerves go to all the different parts of the body that control function. They're not designed to produce pain. Meaning that you could have pressure on a nerve, let's say going to your stomach, that's causing your stomach not to work right. Maybe you get you can't digest food properly, or you get bloated after you eat. And most people would never associate that the thing that's causing the problem is that the nerve system can't control the stomach the way it's supposed to. Or it works like that for every other part of your body as well. I see a lot of patients who have low back pain, pinched nerve or subluxation in their low back, and they also have maybe, say, problems going to the bathroom because those same nerves go to the same parts of the body. Now, when a lot of people come to see me, they want relief right away, and when we specialize in getting people out of pain as fast as we can. But when it comes to true healing, It's sort of like having a splinter in your finger. Now, there's a picture of I got this off the internet, a picture of a splinter in your finger. And if you wanted this splinter to heal, the first thing you would have to do is actually take the splinter out, remove the problem with the finger, allow time for the body to repair itself, and then ultimately over time, that would heal. And I call this the cycle of healing. The first thing we need to do is we need to increase function, meaning make things work like they should. Just like that splinter, we need to take the splinter out of the skin, increase the function, and then over time, what happens is healing occurs. The body's able to heal the damage to the tissue, and over time, symptoms decrease. Now notice what the last thing to happen is when it comes to true healing. Symptoms decrease. It's the last thing. You have to fix what's wrong, allow healing to occur, and then symptoms decrease. And true healing doesn't happen any other way. I mean, you can mask the symptoms with medication, but if you really want to fix the problem, you got to fix what's wrong, allow the body to heal, and then ultimately the symptoms will go away and stay away. Now, how does this apply to you? Well, chiropractic is sort of like going to a mechanic. Let's say you have a very physical job. You stand for long periods during the day, or maybe you're in construction or lifting heavy things or other types of very physical jobs. Or maybe you have a sedentary job. You sit in the office all day. You don't get very much exercise. What happens is over time, your body will get out of whack, or we call it out of adjustment. And what happens is muscles begin to tighten up. The spine begins to lock up. Over time, those bones get to move out of place, like I showed you in an earlier example. And maybe nerves get pinched, and ultimately that can lead to pain or other types of symptoms in the body. Now, our goal here in the office is for you to realize your full potential and get you out of discomfort, as pain or any of discomfort as fast as possible. And that's what we specialize in. We have a very large referral base here in New Jersey, and I'm really grateful to be able to help so many people. And I also, some of the benefits are I get to work with really sick people sometimes, people with cancer and heart disease and diabetes and fibromyalgia patients and women with thyroid issues or other fertility issues. And again, we are not here to treat your disease. Right? What we are here to do is uncover the reasons why you have a problem. What's causing your problem? If you have a headache, and the reason you have a headache is because a bone in your upper spine is out of place, putting pressure on your spine, causing you to get a headache. If we fix the problem, then the headache goes away, versus masking it with some type of medications or any other things like that. And as a result, your body will function better, your immune system will your immune system will function at a higher level, and as a result of all that, your body's able to heal itself. The key is that as long as there's not too much damage. I mean, most people, you get your oil changed in your car fairly regularly, and the reason you do that is because you want to make sure the car lasts as long as it can, and there's no problems with it. Well, chiropractic is just sort of like that as well. We tune your body up, make sure it's working the way it needs to so we can avoid problems, or if you do have a problem, you get better as fast as possible. Again, the key is that for most health problems, as long as there's a certain period of time that if there's not too much damage, your body can reverse it. But ultimately, let me give you an example of a smoker who smoked for 40 years and all of a sudden, develops, let's say, a spot on their lung and they want to go back to having the lungs of a 20-year-old. It doesn't work like that. There's too much damage for too long of a period of time. Now, sometimes people come into the office and they question chiropractic. And what I'd like to do is tell you a little story about how I actually got into the profession. About 20 years ago, I was suffering with pretty severe health problems. I was having ear infections, and I was having high fevers and vertigo, which is very interesting. The room starts spinning around. Digestive problems, and it was really not really linked to anything. And it was off and on for about 6 months. And I went through the whole traditional medical route. I went to the doctor who gave me some pills who were supposed to fix the problem, and that didn't work. And then I went to a specialist, and he actually did some testing. And at one point, he said, we need to do exploratory surgery. Now, it's not like he could say, all right, listen, the problem is right here. He just wanted to go in and hunt around. And at that point, I didn't have any health insurance, and it was a very expensive operation. Needless to say, I didn't have it. But a girl I used to date, her mother says, listen, go see my chiropractor. I'm like, chiropractor? I don't have a bad back. What do I need to go see a chiropractor for? Well, he basically explained to me what I explained to you about how your body works, and if your nerve system isn't working right, then other problems can occur. And after adjusting me for just a very short time, was actually under 2 weeks, 6 months of my health issue went away. I thought that was pretty cool. Actually, it was so cool that I actually sold the business I was in and moved to Atlanta to go to chiropractic school. And since getting back from chiropractic school, what I've also done is spent years studying nutrition and functional medicine. And what this entire knowledge base does is it allows me to look at you in a way that most doctors can't. Again, what we do is we also use advanced diagnostic testing to figure out exactly what's wrong with you, whether that be blood work or hormone testing, along with all the other stuff we do with chiropractic, and figure out specifically what's wrong with you. And when I look at lab work, I also look at it in a way that medical doctors don't. We use functional ranges, which means I'm able to pick up problems where many medical doctors would miss. I mean, let me give an example. We take care of some diabetic patients here, and most people who have diabetes, they're monitored as they go along, and at some point, their body breaks down where it can't control its blood sugar, and then they're put on medication. But if you had looked at a person and done diagnostic testing, you would have seen that this problem was coming for years before it actually occurred. And the key is if you can pick it up then and turn it around then, it's very simple. Maybe some general lifestyle changes or something like that. It's not this big full-blown crisis. It makes a lot more sense to me. Now, having seen the power of chiropractic firsthand, again with my ear issue, plus with helping countless patients with all different types of health concerns, um, I'm here to help you. And what I would like to do is give you just a couple examples of what I've seen. I mean, I've seen so many cool things I've been in practice. One of my very first patients was an older gentleman. Just his eyesight used to get better for a couple hours. Or a young guy used to have a resting tremor, meaning his hand used to shake in the morning with his coffee. Adjusted him, that tremor stopped. Actually, when I was in chiropractic school, a woman came to me and she actually had menstrual cramps, and as a result of, but she didn't even tell me that. She came to me because she had a headache, and as me adjusting her for a headache, her menstrual cramps went away. The point I'm trying to make is that there's really nobody that we can't help in at least some way, right? Everybody gets some type of improvement when their body's working the way it should, and again, chiropractic is an integral part of that. We're open 6 days a week. We're open mornings, afternoons, and evenings, and on weekends. I'm located here at Morris Avenue in Springfield, and my phone number is 973-376-8383. I got in this profession because my life was changed, and I also invite you, if you have any questions about anything, whether it be, can chiropractic help this particular issue, or maybe you have a special situation, or maybe you're even bored. I have old patients stop by all the time. Just give us a call. We're here to help. Again, if you have any conditions I mentioned earlier, such as headaches or neck pain or low back pain, or maybe even a more chronic situation such as diabetes or a thyroid issue or some other type of more serious issue like that, give us a call. I'll be more than happy to speak with you, and most of the time we can get you in the same day. I want to thank you for listening, and I look forward to seeing you soon.